Hi everyone, I'm Dr. Jennifer Brown, and today we're going to talk about egg freezing. So we'll go over who is a good candidate for egg freezing, what the process it involves, how the eggs are stored, and then also using your eggs down the line. As a fertility doctor, the most common things that I hear from patients are that they wish they would have sought treatment sooner, or they wish they would have known more about fertility preservation when they were younger, and they wish they would have known more about the biological clock. So, whether you're an individual who's waiting for the right partner or maybe the right time in your career or education path, or maybe you're someone that's had a medical diagnosis and is requiring medicine such as chemotherapy for cancer that might harm the ovaries' egg supply, fertility preservation via egg freezing can really hit pause on the biological clock and the aging of the ovaries and preserve those eggs for the future. At NRM, we're providing egg freezing treatments for a number of patients for a variety of reasons. Individuals who are diagnosed with cancer, like we mentioned before, might be preparing for chemotherapy that can be damaging to the egg supply, and we arrange for the egg freezing process to start very quickly. We know you're on a timeline, and we can see you generally the next day from when you call with a need and work you in just as quickly as possible. We can start your fertility preservation at any point essentially in your cycle, and we want to help you so that we can get those eggs before your treatment starts. We also see a number of patients in their late 20s or early 30s that are potentially delaying for career reasons, education reasons. Maybe they haven't found the right partner yet, or maybe it's another personal reason that they're putting fertility to a few years down the line. We see transgender individuals who are preparing for medical or surgical transitions and want to preserve their gametes so they can become a parent down the line. We also see patients with autoimmune disorders or endometriosis that need treatment for their medical condition that would be damaging to their egg supply, and so they would like to freeze their eggs prior to starting this treatment that they might really need. The ovaries follow a natural biological clock, and what this means is that as women, we're born with all the eggs we'll have in our life, and this number naturally declines over time. This decline happens whether we're on birth control or pregnant or not on any birth control or have an IUD in place. So this is largely out of our control, and it's just simply age related. So it's virtually independent of how healthy we are. We can't control this. The only things that can affect and accelerate the decline in eggs are smoking, chemotherapy, and surgery on the ovaries. So when we're thinking about the eggs, when we're freezing them, and an ideal age to freeze eggs is usually 31 to 34, the number of eggs that you want to freeze to have a chance of a future baby is really dependent on specifically the age that you freeze them. So when you are 30 to 44, we recommend having 12 to 14 eggs frozen to have a good chance at one future child. So about a 75% chance, 80% chance of having one baby. And that's because typically out of every 12 to 14 eggs, we can get 2 to 3 embryos, and each embryo has about a 65% chance of pregnancy if it has been PGT tested, or about a 50% chance of pregnancy if it's not tested. And so sometimes it takes a couple embryos to make a baby. So if you're thinking as a 30 to 34-year-old that you would like a family of 2 down the line, you will want to freeze double that number of eggs. And then as our age increases, we'll want to freeze more to achieve that same goal. So at 35, 37, at least 15 or 16 mature eggs. And at 38 to 40, it really takes 25 plus, and the studies have shown this because there is that drop off from eggs to embryos. So that means that if you have, 25 eggs frozen, a percentage of those will fertilize and make an embryo, and then a percentage of those will grow into a usable embryo. And so out of those 25 eggs at 38 to 40, you might end up with 5 or 6 total embryos. And at that age, a little over half of those embryos are typically chromosomally abnormal and either wouldn't work or would result in a miscarriage. and a little under half are normal. And so you can see that just following along on the math, it's not an efficient process. You do need a high number of eggs in order to feel that you have that insurance for a future baby. And sometimes this requires doing more than one cycle of egg freezing. And we'll have patients that go through maybe 2 or 3 cycles to set themselves up for success down the line. So what does it look like to freeze your eggs? Well, it starts with just a consultation, and I strongly encourage anyone even thinking about their fertility who doesn't have children and they're between 31 and 34 to come talk to a provider at interim. I would love to talk to you. I'd love to help you plan for the future. The initial consultation is quite easy. You can do this via telemedicine from your home or from your car, from your workplace, not while you're driving preferably. And then we'll always have a financial navigator available to talk to you about your insurance or the self-pay options, depending on what coverage you have. So that initial consultation takes about 45 minutes to an hour and can be done conveniently from your home. So then we'll spend the next cycle. So if you have, a 28-day cycle, we'll try to catch you at the right time in your cycle for a diagnostic workup with an ultrasound and blood work. So on the ultrasound, we're going to look to see what your antral follicle count is. That's going to tell us how many potential eggs we can get with one cycle of IVF. And then the blood work, the AMH hormone, is going to give us an idea of your quantitative ovarian reserve and help us plan your protocol to get out your potential sort of maximum number of eggs in that one cycle. And when we do this, we're not stealing any eggs from your future. We're not going to make you go through menopause any earlier. We're just maximizing the egg yield from that one cycle, knowing that even though we typically only ovulate 1 egg per month because we're humans and we like to have 1 baby at a time, you actually have a batch of maybe 10 to 15 eggs that are usable that month that can also be good eggs. So after we've done that ultrasound and blood work, we'll follow up, make your treatment plan, finalize what you are hoping to do and hoping to accomplish, and design a plan for you. You'll meet with your nurse and learn how to use your medications, and get your cycle all set up. And then once you message us with day 1 and you have your medications in your hand, we'll go ahead and start the cycle. The cycle takes about 2 to 4 weeks to complete. There's 2 weeks of that time that are your busiest time, where you're taking these little injections to grow your batch of eggs, and you're coming in every other day for ultrasounds for a total of about 3 to 5 visits, so that we can monitor the growth of the follicles and know when the egg follicles are ready for us to take you to egg retrieval and get those eggs out. So the cycle culminates with your egg retrieval, where you're asleep under a sedation type of anesthesia, which means through your IV, you're actually breathing on your own. You're not intubated, but you are totally comfortable with an anesthesiologist with you at all times while we take the eggs out through the vagina. There's no incisions typically on the outside, on your abdomen, but every egg can be retrieved typically through the vagina with just a small needle that's kind of similar to getting your blood drawn. So it's a small needle puncture that you would never notice. It just closes up on its own. So after you've used the medications and taken these again for about 10 to 12 days and undergone the egg retrieval, you'll wake up from the procedure and you'll know how many eggs you had retrieved. And later that afternoon, you will know how many of those eggs were mature and therefore frozen for your use down the line. And they'll be frozen that same day, all the mature eggs. And they're frozen in a manner that's actually a flash freeze, so it's called vitrification. Side effects are typically minimal with the injectable medicines. However, for some patients, they notice that they may heighten underlying emotions. And so in this way, maybe you might notice some mood swings. Some people will occasionally get nausea, just typically because their abdomen is getting more full with those follicular egg sacs, which are each like a little 1 to 2 centimeter water balloon. Some people will notice some mild soreness or redness at the injection sites where they're giving themselves the medication, but this is all typically well tolerated, and your nurse is there the whole time to help you with any difficulties you're having. After the retrieval, you might notice some bloating until your period comes, because all those follicular egg sacs are actually still a little bit full and will slowly resume back down to their normal size by the time of your period, which comes about 2 weeks after your retrieval. One of the risks of an egg freezing cycle is something called OHSS, or ovarian hyperstimulation syndrome. And this happens when you grow so many eggs and your estradiol or hormone levels get so high that you actually start to leak a little bit of fluid from the ovaries into the abdominal cavity. And you might feel bloated, you might even look bloated. There are some categories of OHSS, from mild to moderate to more severe. Almost everyone who stimulates a whole batch of eggs is getting mildly hyperstimulated, but our goal is to prevent you from having moderate to severe hyperstimulation where you're so full that someone else could look at you and notice your abdomen was swollen. Also, and most importantly, where you're more uncomfortable, and OHSS can become a more significant complication. So we have a lot of tricks to avoid that, including those frequent monitoring visits where we can titrate down your medicine if you're showing signs of OHSS. Some more or some less common risks associated with egg freezing might be infection or bleeding, but most egg retrievals are a simple and straightforward procedure with a low level of risk. So eggs at this point can be stored indefinitely. They're stored in liquid nitrogen. There have been many successful pregnancies after they have been stored, and thus far the studies show no increased risk of birth defects over the risks that are associated with IVF, and no increased risk of pregnancy complications. So your eggs are actually frozen via a method called vitrification, which actually means that rather than being frozen, they're suspended into a glass-like state. The drop in temperature is so fast that it avoids ice crystal formation. And this is really important because the egg is a very vulnerable cell. It's a single cell full of water, and any ice crystal formation could damage the DNA and the integrity of the egg. So they're vitrified and flash frozen via an embryologist loading them onto a cryo device and plunging it into liquid nitrogen. So when you store eggs at these extremely low temperature, you can halt all the metabolic activity and allow them to be safely preserved over time. So what happens down the line with your eggs? Well, you may decide to thaw them, a year or 3 years or 5 years later, or even longer. And at that point, what we would do is identify your sperm source, whether it's a donor sperm or your partner, a male partner with sperm, and we would thaw the eggs and then fertilize with a method called ICSI. You can see in this picture a pipette on the left side holding an egg in place, which is on the right side. You can just see half of that little egg, and you can sort of see the tip of a small needle injecting right into the egg, a very small sperm. And so intracytoplasmic sperm injection is the best way to start the fertilization process for eggs that have been previously frozen. The eggs and the sperm will then be left in culture, fertilized overnight. We'll see how many fertilize, and we'll grow these into embryos now for 5 to 7 days until they become a blastocyst. If you are planning a fresh transfer and trying to get pregnant right away, we'll transfer the best embryo on day 5 and then freeze any other embryos that we have. Alternatively, some people choose to genetically test their embryos, and that involves taking a small biopsy on day 5 to 7 and then freezing the embryos, which would stay in place at an NRN, and the biopsy sample would go off to the genetics company to be analyzed for chromosomal euploidy or chromosomal normality, seeing if they have a full set of 23 pairs of chromosomes. Also, some people choose, even without the testing, to freeze their embryos and just know how many embryos they have for future use. Embryos are more easy to translate into, what it would take to get pregnant because, as we said before, from every 10 eggs, there's a natural drop-off to how many embryos you would get. So let's say you have 10 eggs, you might end up with 2, maybe 3 embryos. From 20 eggs, maybe 4 to 6 embryos. And so once you have that embryo, especially if it's PGT tested, you then know what your success rate. So a PGT tested euploid embryo would have a success rate of about 60 to 65% of becoming a live birth. So hopefully that helps you understand why people consider egg freezing, what the process is, and what it all entails. We'd love to see you and talk about your individual situation and help you understand what the next step would be for you. So don't hesitate to give us a call. Sooner the better. I think if you can do a quick telemedicine call, I think that could set you up on the right path for success, even if that family that you're looking for is down the line. Thanks so much, and feel free to email me at drjennybrown@nrmvt.com. Thanks. Bye-bye.